And though this Ebola epidemic is particularly dangerous, we've seen deadly diseases cross borders before. H1N1, SARS, MERS. And each time, the world scrambles to coordinate a response. Each time, it's been harder than it should be to share information and to contain the outbreak. As a result, diseases have spread faster and farther than they should have, which means lives are lost that could have been saved.
The big thing we can do is get rid of this horrible, I call it the unseen enemy. You call it, there's 1,000 different terms for it, but whatever, it snuck up on us.
It's actually not a wasted month. It's a wasted 2 months because it was actually early January when the Secretary of Health and Human Services was alerted by Chinese counterparts that an outbreak was underway in Wuhan. And from that moment, based on my experience as National Security Advisor, having worked the Ebola epidemic, Zika, having been part of the President's cabinet when we dealt with H1N1 swine flu in 2009, that's when all the gears should have started turning, because we have known for decades that a pandemic of global magnitude was imminent.
First, let me provide a brief update on the situation. As of today, the CDC has reported 5 cases of the novel coronavirus infection here in the United States. China has now reported more than 4,500 cases. Americans should know that this is a potentially very serious public health threat. But at this point, Americans should not worry for their own safety.
Keep in mind, it's not just that we don't have a czar in the White House overseeing the response, but we don't have that contingent inside the National Security Council. We don't have the seasoned veteran contingent inside of Department of Homeland Security. And we don't have this whole global health mastermind group inside of the Defense Department and HHS. These were all eliminated in 2018 by Trump.
When the president eliminated those global health security teams in all of those agencies in 2018, was there a reason? I mean, was there an argument against them?
Some of the people we cut, they haven't been used for many, many years. And if we ever need them, we can get them very quickly. And rather than spending the money, and I'm a business person, I don't like having thousands of people around when you don't need them. When we need them, we can get them back very quickly.
The Event 201 scenario is fictional, but it's based on public health principles, epidemiologic modeling, and assessment of past outbreaks. In other words, we've created a pandemic that could realistically occur.
It began in healthy-looking pigs, months, perhaps years ago. A new coronavirus spread silently within herds. Gradually, farmers started getting sick. Infected people got a respiratory illness with symptoms ranging from mild flu-like signs to severe pneumonia. The sickest required intensive care. Many died.
Another big story we're following, a jump in cases of a deadly mystery virus. Health officials stepping up screenings at major U.S. airports. The World Health Organization calling an emergency meeting.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus. The main reason for this declaration is not because of what is happening in China, but because of what is happening in other countries. Our greatest concern is the potential for the virus to spread to countries with weaker health systems and which are ill prepared to deal with it.
Is this outbreak at a tipping point now?
The window of opportunity is still there, but our window of opportunity is narrowing. I would put it that way, narrowing.
President, the CDC said yesterday that they believe it's inevitable that the virus will spread in the United States, and it's not a question of if, but when. Do you agree with that assessment?
Well, I don't think it's inevitable.
It's not just a case that this virus is a crisis and that this infectious disease is spreading in the United States and we have to cope with it and it's got exponential growth. It's not just the natural attack of the virus. This far into it, with us this much exposed to it already, so much exposed that we're closing in on 5,000 Americans dead by tomorrow, right? With the White House expecting, hoping, that they'll keep the death range for Americans between 100,000 and 250,000 people, right? This far into it, the federal government, the stuff they are actively in control of and nobody else is, that stuff doesn't get better ever.
And what keeps me up at night is not just the numbers, but a deep sense that it didn't have to be.
You're going to the unconscious fever cough on 103rd and 37th Avenue, 492 Charlotte.
5180 asthma fever cough, 109 Road, Farmers Boulevard, 5180. 46, stand by. 46 Frank for the cardiac defibrillator. Fever cough, 28th Street, 24th.
Rasp fever cough, 4 Leah Britton, 84 Adam. 46 George, Rasp for Corona, 48, 46 George.
It's going to be 98th Street and Corona Avenue for the defibrillator fever cough.
9 Avenue responding for a male 79 years old with a fever cough.
For a rest fever cough on 37th Avenue.
Charlie, that's affirmative. 1 Charlie, can you show us heading back to 97th Avenue, 98th Street for PPE, please?
Sorry, go to the card breather. Fever cough. 510 for the defibrillator fever cough.
With all the knowledge, all the medical talent, all the advanced technologies at our disposal, it is unacceptable if, because of lack of preparedness and planning and global coordination, people are dying when they don't have to. So we have to do better, especially when we know that outbreaks are going to keep happening. That's inevitable.